After the global community was impacted by a severe pandemic, the importance of healthcare and healthcare technology field is felt more than ever before. In recent years, healthcare has become an integral part of the business ecosystem in India. While healthcare itself is a noble profession and majorly contributes to humanity, the successful healthcare entrepreneurs are making a valuable contribution to the national economies around the world. Medicircle presents Top CEOs of the Healthcare series, where we are featuring healthcare CEOs who are influential role models to share their views about the future of the healthcare industry. Hello, I'm Sana Khan, and you're watching Medicircle. Today we have with us Mr. Anmol Arora. Anmol, being an IIT Indore, is currently a CEO at DocVita, which is a telemedicine platform to consult with India's top doctors and specialists under the same roof. He has also been a founder and CEO at Chota Hospital Private Limited in Indore. Hi, Anmol. Welcome to Medicircle.
Hi, Sana. Thank you so much for having me here.
Okay. Anmol, the three major challenges of the healthcare industry are affordability, availability, and accessibility. What, according to you, is the solution to eradicate these issues?
Sana, you are very right about the fact that three cornerstones challenges of healthcare, which are cited as one of the biggest obstacles, are indeed affordability, availability, and accessibility. But there's one more challenge that isn't talked about very often, which is quality of healthcare delivered.
Right.
Many people don't know that more Indians die of poor quality care than due to lack of healthcare access. And even according to a report published by Lancet, there were 2.4 million Indians who die of treatable conditions every year, out of which 1.6 died due to low quality of care, almost twice of the other 0.8 million who died due to lack of accessibility. Right. So therefore, it's of utmost importance that when we talk about affordability, availability, and accessibility, we're not compromising quality.
Right.
Our country is very diverse. We have a vast population, small, simple barriers like language, culture, awareness. They're very different from individual to individual.
Right.
If you ask someone a very fundamental question, what's affordable to you? That is a question which varies from everyone to everyone. Again,
Right.
what's available around you? What channels of healthcare can you access? If you have a smartphone, if you don't have a smartphone, if you have access to a PC or not, what is the meaning of quality healthcare to you? Some people are okay, like getting certain kind of treatments done, but some people are not. So, I mean, because it's such a large country with such a large diversity, all these terms mean different from different people. And that is what makes these very hard to solve, because it's so tough. It's so tough to factor affordability, availability, accessibility, and quality for 1.3 billion people in a country, right? So this is just like a deep dive into challenges, but that doesn't mean that it's impossible to solve them, right?
Right.
Situation has improved considerably in the last few years.
Sure.
Obviously, due to the COVID-19 pandemic, healthcare has taken center stage, and in fact, on everyone's mind, immunity and health is at the forefront. And we've been seeing this change inside of DocVita as well. Like a lot of people come and ask about preventive care, a lot of people come and ask about immunity, right? And then a lot of people are aware that they have to take action. People don't sit on problems now, because something as simple as a flu symptom triggers a COVID-19 fear, and that's when they immediately access care, right? So when it comes to solving challenges, I think people will play a major role here. The awareness will play a major role here, and the second thing when we talk about affordability is definitely healthcare will become more affordable when healthcare providers of our country will be able to manage their costs, because obviously they can't function without a proper cash flow, so they need to manage costs. And some costs that really drive up our healthcare and pricing are obviously expensive equipment. A lot of it is imported, high operational costs, high administrative expenses, and especially there are a lot of drugs also which are very expensive, right? Which also make treatments not affordable. But there's a trend that I am, as an entrepreneur in healthcare ecosystem, I'm observing, and a lot of my peers as well, is that a lot of Indian medtech companies are coming up. and they have come up and they have reduced the cost of equipment considerably, right? So I think, and it's the same in pharmaceuticals, the same in everywhere, right? So I think with the right government and innovators collaboration, we can actually not only solve the problem of affordability in India, I think we can solve the problem of affordability for the world. And that's the mindset we have at DocVita, and that's the mindset our country and entrepreneurs should have. Because we're not just like, we can obviously solve problems for India, and that should be a given. We take that this country will solve its problems, but we can also put India at like a global map for medtech innovation. And like, obviously, when you talk about accessibility, there are a lot of technology startups in this space now. It's so easy to talk to a doctor at any point of time that you want to, at any point of day that you want to, anywhere you want to, right? And obviously startups like us, which are empowering medical teams to deliver care, and the startups like startups which are solely focused on building infrastructure for telehealth, solely focused on building infrastructure for clinics, solely focused on hospitals. So I think sort of like there's a lot of innovation happening in the country. But one thing that the government has announced, which is going to have a huge impact, is NDHM. And I think the National Digital Health Mission has the potential for all of solutions like us to collaborate, and then deliver something called as accessibility to the rest of India, right? And that'll lead to very meaningful implementation of of technology, of awareness, and all of this will come together to sort of like, you'll see these problems getting solved like day by day.
Right. Okay, Anmol, how has your journey been in the healthcare industry?
Funny that you asked the question. Very full of ups and downs, obviously, just like every entrepreneur. We've come twice close to almost running out of cash, but we've survived, and like we've come out stronger. What kept us going was like the positive feedback we kept getting from our clients, and then the impact we were able to create over the last couple of years. Now there have already been more than 100,000 appointments that have happened on DocVita's infrastructure, and like the impact that we've created. So before COVID, like our major customer base used to be clinics, small clinics, 1 to 2 doctors, where we were enhancing the experience of patients visiting these establishments. And we were like a lot of thought. We put in a lot of thought into how a patient experiences care, and our single priority was that when a person walks into a clinic, he is or she is already in some kind of pain, and the experience of the whole healthcare should not be a pain, because that's what like brings that negative aspect of healthcare, right? If experiencing healthcare would have been okay, you would not sort of like feel lazy going to a doctor, right? So I mean, like, we wanted to make it seamless, and that's what we've been doing. But when COVID-19 hit, most of our clients were also hit. A lot of doctors are not able to see their patients, and that's when telehealth came into the picture, because one of our clients just called us 2 weeks into the COVID that a lot of patients are trying to reach me, but I can't reach them. I've been doing this on WhatsApp. It's getting out of hands. And then me and my co-founder, we jumped right in. We said, okay, we'll help. So we built payments, we built video consultation, and then I think that was the starting point of telehealth. And then our clients loved the infrastructure so much, then they told us that, why don't you build a listing? There are a lot of startups who are listing doctors on the platform, and who are sort of like not only making healthcare more accessible and available, but also sort of like, helping doctors manage the infrastructure better, because we already had the other half of solution. So we went and built the first half. And then since then, I think more than 2,000 patients have connected with doctors on the platform. It's a small number, but we're growing, and like we're seeing a lot of word of mouth happen of our infrastructure, because the one thing that we tried to build different from other platforms is most platforms have built healthcare in a restricting fashion, in the sense that they would only allow appointments on their own platform.
Okay.
And what that happens is that what we've observed also is that most people want the convenience of like what they have available at hand. For example, if somebody does not have the DocVita app, we are okay if they consult a doctor on WhatsApp, as long as they get access to a quality doctor, they get their treatment, they get their prescription. We also have a lot of mental health consultations happening on Zoom, which is very surprising, because people don't trust platforms to do mental health consultations. When they have a fear, it might get recorded or stuff, although that doesn't really happen. But people people want to feel comfortable, and I think we have prioritized that since day one at DocVita. So that's what we're doing. The latest hit thing at DocVita has been payments for doctors. I mean, if you are a doctor who has been managing everything on their own, because usually small doctors with clinics don't have very big teams to manage
Right,
everything.
right.
So we built a payments solution for them, and they loved it because their payments were all over Paytm, Google Pay, and in different apps, and it was very hard to keep track of who has paid how much and from where,
Right,
like sort
very
of
true.
we're getting.
Mm-hmm.
And then we just like made it very seamless for them. It was like sort of their own payment gateway, a customer solution for
Mm-hmm.
them, and they loved it. So since then, I think sort of like the and payment is a major friction in healthcare. For
True,
example,
very true. Yes.
if you are asked to jump 3 hoops to pay a doctor, that then also is different. So we have empowered all doctor staff and all doctors to accept payments from their patients using any payment mode that's comfortable to the patient. And
Mm-hmm.
our journey is, I think everything is just coming together for us, and we are just like starting to see growth in numbers, growth in traction, a lot of positive word of mouth feedback from our patients, from our doctors, and that's what keeping us going.
That's nice. Okay, Anmol, we have seen a lot of changes in the way the healthcare industry works due to COVID. What, according to you, will be the future of healthcare?
So when you say future of healthcare, I mean, I dial it down into the participants in the future
Mm-hmm.
of healthcare, and obviously there is like a care seeker and a caregiver,
Right.
and I
Mm-hmm.
think that interaction is still 90% of this. Like the interaction has changed, just the medium of interaction has evolved, right? A lot of things which used to happen, like in
Right.
person, are now even happening in person in a different fashion. So I
Right.
recently visited one of our dental clinics who has been running on DocVita for about 2.5 years now.
Okay.
So I went there, and like the experience of visiting a dentist is completely different from what it used to be. Like you have to wear masks. All the dentists are in full PPEs.
PPEs.
Like so offline experience has also been impacted. Other than like most people saying that online experience is impacted, right? So the one thing that I think a lot of providers and a lot of patients would agree is
Mm.
that uh, is that the providers did not used to engage with patients a lot before. I think sort of like a lot of providers were dependent that whenever something wrong would happen, people would just walk into my clinic and get a treatment.
Right.
But now I think that thing has changed. Most providers in this country now want to make themselves more accessible to patients. They want to be more available for their patients. And because the
Right.
competition is growing, I think that is a trend that is going to continue to surge. In fact, we have some of the doctors on our platform who want to inspire their patients to be healthy, who want to continue to inspire their
Right.
patients to be healthy. And that's
Mm.
like a step in the right direction. So I'm really excited about like what's the trend changes that are happening in the healthcare industry. One more trend that has been coming up, and they've already been approached by 2 companies to do this. I think people are now thinking about connected and interoperable healthcare infrastructure. Like your medical records in one system should not be limited to only that system. There are players who are trying to now like link within each other and just
Mm-hmm.
reduce the friction. If you were to visit one hospital and the other, your medical records should seamlessly transfer between the two places. So
Okay.
so that is one thing that is, I think, sort of like also happening, except for like, as I already mentioned before, the shift in preventive healthcare. Like people want to be healthy,
Right.
people want to take control of their health, and yeah, we also have an exciting launch coming up in preventive healthcare, most likely I think mid-April or like late April. But yeah, I mean, this pandemic has accelerated definitely the importance of like physical and mental health, and people like sort of like are now inspired to sort of like take charge of their health, and they
Right.
value
The
health much more, I think.
realization, the realization has taken charge.
Yes,
Right.
yes, no,
Okay.
the value of health is much more.
True, true. Okay, Anmol, India's total healthcare spending is at 3.6% of GDP, which is very less compared to other developed countries. Do you think it's high time India needs a generous amount of spending in the healthcare sector?
It's a very uh it's like a very political question as well, but okay. So short answer is that we do need a more generous spending in healthcare,
Mm-hmm.
because it's it, it's not what we so it's like it's essential. It's sort of like a baseline, right? We do need infrastructure and some more sort of like uh, capacity of our healthcare, right? But I think we need to think a little bit beyond the percentage number here. Like when we compare, when we benchmark, let's not benchmark the percentage of GDP, let's mark the outcome. And let's say, okay, this is the outcome that we want to achieve, and what do we need to do with that outcome? And it's not a secret to the rest of the world that India has significant cost advantages, and we can outperform West in terms of costs, like without compromising the outcome. Like we don't have to get to the spending of 8-9% up to the UK or US level. We might actually achieve that either within this budget or like maybe in 5%, maybe in 6%. I don't know the exact figure, right? But the one thing that I think we need to talk more about is when we say, okay, we want to increase allocation of GDP into the sort of like healthcare, we have to talk about meaningful and impact of allocation, and we have to get to a stage, because I think a lot of systems are interconnected now. We can measure the impact. And I think now we are more equipped to do this than ever, because sitting in a single control room, probably one government department can have the access to what's happening all across the board in all clinics, on primary health clinics as well, right? So when we have that kind of measurement and of impact, when you have that kind of control over systems, I think we would be able to measure and demonstrate improvements, also find out where we need to invest to improve more. And if we sort of like begin on that journey today, I'm pretty sure that in 3 to 5 years of time, we would be setting an example for the rest of the world to follow. And in the sense that we will do it in less spending, of GDP. We don't have to match the West level, but I think we can do much better than them if we are given that budget. So
right. Very well said, Anmol. Thank you so much, Anmol, for coming to our show and sharing your valuable time and insights with us. It was a pleasure having you on the show.
Thank you so much, Sana. It was a pleasure being here as well.
Thank you. Bye. Have a good day.